afternoon, everybody, and thank you so much, Maria. I'd just like to start by thanking all of the staff and volunteers working behind the scenes at the Broadband Institute who have made our ability to connect possible today, even when sometimes we're stuck on mute. And I'm pleased to be here on behalf of SEIU. The Service Employees International Union proudly represents over 2 million members across the United States, Puerto Rico, and Canada. As president of SEIU Healthcare, it is a privilege to represent 60,000 frontline healthcare workers in the province of Ontario. In Canada, we represent about 120,000. This has been a year like no other in representing the women and men on the front line of this war against COVID-19. People like the late Maureen Ambersley, an RPN whose life was lost simply because she went to work in service of her community. Some of us have heard the voice memo she sent to her son during the pandemic. The conditions in long-term care were deteriorating, that the for-profit employer wasn't distributing PPE, that the conditions of work meant care was compromised. We could hear in her voice the familiar sound of a mother, a caregiver, an immigrant woman of color who is most definitely a skilled worker who deserved better from the country she served. All of us are here today because we cannot and will not permit the status quo to continue. That's why having allies like Dr. Arya is so encouraging. I really appreciate and value our relationship that we've built over the last year, Doctor. All doctors serving on the front line, using their respected voice to reveal the ugliness of a system that, as Andre Picard says, robs workers and seniors of autonomy, respect, and dignity. So thank you, everyone, for asking me to participate today. Thank you so much, Dr. Arya, for your solidarity. And it's my pleasure to be here with all of you.
Yeah, thank you so much, Sharleen, for those very kind words. Really some very powerful words for all of us to reflect on and think about. I mean, I can share some of my experiences, and I've been working in long-term care for many years now as a family physician, and then later on when I retrained as a palliative care specialist. And through the pandemic, I worked in long-term care homes which had large-scale COVID-19 outbreaks with over 100 residents that were infected. Of course, these homes were private for-profit long-term care homes, and I'll just never forget the devastation and the suffering that I saw. There were people that were sort of gasping for air without oxygen being provided to them, frontline health workers that were run off their feet, not having enough PPE, double and triple shifting, the phone ringing off the hook because family members were locked out at that point and were so desperate to just even hear one word from their loved one and hear about a medical update. And often it would be our team that would be calling the family members to let them know that their loved one was dying from COVID-19. So through such devastation and through what was undoubtedly a humanitarian crisis, many of us have put our energy and channeled the extra time that we have or we're supposed to have, into advocacy, because it's very clear that the long-term care system, as it's currently running, even though vaccinations have been given and thankfully COVID-19 has ended, was always in a crisis. The long-term care system was always in a crisis, and it's completely broken. And now is the time for all of us to come together and change this broken system. Currently, I can add, I actually work as a palliative care lead in Kensington Gardens Long-Term Care Home, which is a not-for-profit long-term care home in Toronto. And I also provide consultations in long-term care homes from a palliative care specialist perspective. And I'm just so happy and pleased and honored to be joining Sharleen and to be speaking in front of all of you today. So reflecting on Andre's excellent talk, Sharleen, I mean, what are some of your initial thoughts? And I mean, what do you think about, the top priority to address in long-term care right now?
Well, like Andre said, number one, obviously, is staffing. There is definitely real concern, and we've heard it before, as you said, about staffing. There's a motto that we'd like to say, a motto that we like to use at SEIU. It's respect us, protect us, pay us. And I believe what that means, and I think Andre Picard shared, is also what elder care expert Pat Armstrong that we've all heard teaches us. The conditions of work become the conditions of care. Until we offer working women in the care economy the respect, the protection, and the fair pay they deserve, they will continue to treat fragile seniors as a disposable commodity that serve only as a cost input into the value creation for real estate developers. Nursing home chains, that's their priority. We need to put the workers and the seniors as a priority in this business. So it won't be a surprise to you to hear that I believe the solution is actually really quite simple. Number one, pay the staff well. We have to stop the precariousness of this profession. We have to provide safe jobs to the staff, and we have to hire more staff. These are skilled workers doing hard jobs. The care in nursing homes and long-term care has become much more skilled and much more demanding. So let's make our top priority the human beings that we call staff. People, like I said, the late Maureen Ambersley. Only then can Andre Picard's key elements for what the caring economy in LTC could be achieved. But Dr. Arya, I'd like to ask you about what you think we can do better. I'm reminded, again, for some of you that might have watched it last night, President Biden's bold new proposal to spend $400 billion in the care economy. He touched on it last night in his address to Congress. Learning from that bold move last night and how that country is embracing that, what do you think Canada could do better for the care economy?
Well, it's undoubtedly, the case that we know that our long-term care system has been under-resourced and understaffed, for decades. And really, if we don't fix this after COVID-19 and after so many people have suffered and died, often in the most egregious circumstances, and often, honestly, not just from COVID-19, but from neglect and abandonment, from loneliness and dehydration. I mean, what will it take for us to fix the system? So undoubtedly, this is the time to really hold all of our politicians accountable and make that investment that's needed. I mean, it's something that we're all going to face very soon as our Canadian population is aging faster than ever. Many of us have parents and grandparents, and we might be worried about their care. And actually, 2021, is actually the year that the largest age cohort, baby boomers, turns 75. So we know that there's going to be an increasing demand for elder care, for better home care and long-term care. And personally, Sharleen, I do like how Andre brings up home care, because as a palliative care physician, I can tell you that I work in that system as well. And I see that people don't want to be institutionalized. People don't even want to be in a hospital at end of life generally. They want to be at home. And while that's not achievable for everyone, we have to pay equal attention to home care and realize that that's also underfunded and has many of the same systemic problems. And, perhaps we have to look at our healthcare system not as silos, which we often hear about in the media, where we just hear about hospitals or we only hear about long-term care, but rather as a circuit where we realize this is all connected and it's all part of a continuum of care. Specifically talking about President Biden's announcement, we may remember from the federal government here in Canada, they did agree to invest, $30 billion in childcare, but a much lesser amount, $3 billion in elder care. And that's, I think, a cost that we know is going to need to increase. And I reflect upon sort of the report from Sheila Block and Simran Dhanna, from the CCPA, where they actually estimated that it would cost $1.8 billion just in Ontario to adequately fund caregiving in long-term care homes. So obviously $3 billion is probably not enough, and we're only going to get what we pay for. And then the second issue that comes up is the private for-profit long-term care homes, where it's undoubtedly clear when we're speaking about taxpayer accountability in the middle of an economic downturn, in the middle of a pandemic. We're not going to get that from the private for-profit long-term care homes, where they're keeping their health workers poor and providing an inferior standard of care so that they can pay millions of dollars to shareholders. It's time to hold them accountable and take the first steps to get profit out of long-term care.
Agree so much. And again, that touches a little bit on what Andre says in his presentation about the right care, the right place, and the right time will equal quality of life. And I think we need to pause and think about that. I know that this might sound harsh, but it must be said. We don't value our elders in this country, and we don't value the workers in this sector who are predominantly women, and we all know are predominantly women of color. And who makes up the long-term care constituency? It's those people, the elders, the workers, the women, and workers of color. Again, in our current values equation, what we seem to prioritize is the hundreds of millions of dollars paid annually, like you said, to shareholders in our biggest nursing home chain. Provinces don't find them when they break the rules. I mean, yesterday here in Ontario, we got the Attorney General's report. And again, what is the accountabilities? Provinces don't take away their licenses when people die from corporate negligence. No premiers go on the boards, and the cycle of dependency, disrespect, and indignation continues. So doing differently means valuing the people we've neglected far too long. If we demand the highest standards and protection for childcare, as you said, we should then expect the same guardrails to protect our most fragile elders and the women who take care of them. Again, there's so much to be done. The last year has certainly shone a light on it. Andre also says, stop studying so many studies. It's time to act on this. And I'm so appreciative that we're having this conversation today.
Yeah, that's absolutely the case. I think many of us working in long-term care and, seeing the situation that's unfolding where, really here in Ontario, I can speak to how, vaccinations thankfully have been completed, and there was a delay there, unfortunately, which resulted in many unnecessary lost lives. But once they were done, really, we're not seeing COVID-19 now, and that's such a big relief. But we're still seeing the crisis, the humanitarian crisis, still ongoing related to staffing, where people, for example, may have to wear a diaper because there's not enough staff to take them to the bathroom on time, not enough staff to give them a regular shower. And we can imagine how bathing would be so important for people who spend most of their day in a wheelchair or in bed. And that really speaks to how the system has to be fundamentally overhauled at this time. And we have to think about who we really value at this point in our society. And Sharleen, you brought out that point so well. I remember sort of, calling people, when I was in these long-term care homes with COVID-19 outbreaks, there were people who were veterans who had served our society, really in a way that, I can't express, and had, sacrificed or put their lives on the line for us, parents and grandparents of people who had worked so hard. And ironically, as Andre has brought out, this is actually the generation that gave us Medicare, the Tommy Douglas generation. So it's so ironic that they had to spend their last days and their last, phase of life in these private for-profit long-term care homes. And really it's time, as you pointed out so well, Sharleen, it's time for a root cause analysis of why we're in this sort of place at this point in time. And we can't sort of forget that we have to talk about how this is a fundamentally oppressive system that is entrenched in ageism, in ableism, in racism, and in sexism. And until we bring those issues up, and until, even those who are in power acknowledge the fundamental flaws in this system, it will never get fixed. But now is the time. Now is the time.
I like what Andre says too, again, about the last resort should be that these seniors go to a long-term care facility. Absolutely, we've got to start focusing on home care services. People want to stay home. That is a whole nother sector that needs the same attention. Again, there's so many caregivers that want to be in this profession, and I thank God for them every single day. I've had to utilize home care for my father. So all of these, they're so critically important, and the outcomes are better. People who stay home longer have better recoveries that I'm sure you would, agree with. So again, home care is another. It costs a lot of money, speaking of our universal Medicare, but there's so many solutions. I just think it takes the courage, the will, and some bold premiers and some, decision maker politicians to step up and do the right thing. We've been, again, studying and debating so long. It's time that we really stand up, if not now, when, to the crisis that's going on out there. Protect those caregivers because they're critically important to taking care of our loved ones, and give those who are receiving the care the respect and dignity that they deserve.
Yeah, can't agree with your words more, Sharleen. I mean, I can tell you, I mean, it's very true. Our home care system is fundamentally broken, and how we fund long-term care, as Andre Picard mentioned, is really flawed. I mean, I really think long-term care should be more of a verb rather than a place. And right now we have this system which disproportionately warehouses seniors and sort of, puts them away from society, out of sight, out of mind, where nobody can see what's happening, when in fact we need to integrate people into society once again. I mean, this is actually a very meaningful and valuable time of life that people spend. And as Andre said, I mean, it's not that elders, only want to spend time with other seniors. They want to spend time with people of all age groups and backgrounds. So we need to have that social integration and realize that social care is so important. Medical care should be supporting the social care rather than the other way around. But yet, when we go into a long-term care home, it doesn't look like a home. I mean, first of all, there's not enough care. And secondly, it looks like an institution. It looks and feels like an institution. People are wearing uniforms. I mean, the care is regimented and rationed, and it's not based on quality of life. It's not individualized, and it can be compared more to an assembly line. And I remember, I mean, this is the problem, where even if people are requesting to sleep in and, not have their medicines at 8, or if people want to sort of have ice cream for lunch and not, be forced to just have, the 3 options on the menu. Many of those things are very hard to come by, and that's absolutely a travesty. And I think there's many lessons to be learned from other countries. And of course, if we don't look at what has happened in our own country, shamefully, during the pandemic and COVID-19 and long-term care, where our country is perhaps amongst all other wealthy countries, OECD countries, has fared, the worst. And if we don't fix this system, I mean, I don't know, if we can look at ourselves in the mirror as Canadians. And once again, it's time to hold our elected officials, accountable for this. One thing that gives me hope is that the public is completely aware of what has happened in these long-term care homes during COVID-19, and it is something that is a priority. I mean, a recent sort of survey has shown that 86% of Canadians want to make long-term care public and part of the Canada Health Act, part of Medicare. So that's something that tells us the partisan issue. This is something that's going to affect all of us as we age. It may be already affecting our loved ones who are getting older, our parents and grandparents and other elderly relatives. So it's time to, once again, we have to hold our politicians accountable. We need to stop studying the study and actually take the action that's needed right away.
Yeah. Absolutely. One of the things I've said over the last year is, like, I've embraced everybody who's entered into this conversation, who's stood up and, identified the injustices that have happened in senior care over the last year because of the pandemic. But I've constantly said it takes a village, and we cannot, after this pandemic has, gone away, forget this moment. We have to keep, like they say, the feet to the fire. We have to hold those decision makers who have the authority and the ability to make changes, and those who are in the business accountable to deliver the dignified quality care that seniors and their families want for their loved ones. So again, I'm calling out to everybody, let's not, go back to whatever our new normal is going to be and forget about what happened this year in this critically important care economy.
Yeah. So we're getting a question here, and I think this is an excellent question for you, Sharleen. How can we best ensure that an inclusive, equitable, and comprehensive racial justice agenda is being specifically addressed through all of our care economy related advocacy? And how does that work for elder care?
Yeah, that's a really good question. Up until just recently too, we point out that there's been a lot of studies done. But what we didn't dig down into, or at least people refuse to bring to the top of the agenda, is what it says, the racial issues in there, and the gender issues, and for lack of a better word, the isms that are existing in this sector. Again, this is proven not only in the care industry, but in the service industry, that a lot of racialized workers are the ones who are being the most exploited in our system and in our economy. They are the ones working the precarious jobs, the part-time. They all have to work multiple jobs in order to secure a full-time living wage. They are predominantly women in the care and service economy. And again, it's the non-paid sick time, no benefits. I mean, a lot of what you see in this industry racialized women, single mothers who are trying to seam together multiple jobs just to live what each one of us as Canadians want. To be able to have a full-time job, to have benefits, to retire with respect and dignity, and hopefully have some money that you can put your children through college. So we have to have the really tough conversations about how this is injustice has been existing for a while, not just the care that we provide, but how we treat these racialized and predominantly women who are serving. And also inside those long-term care facilities, predominantly are women and racialized communities as well. So we need to have that conversation and address that. Don't just put that on the back burner as we move forward to improve the service.
Yeah, absolutely agree with you, Sharleen. COVID-19 is a crisis in which has exposed the inherent sexism and misogyny in our society, and has exposed the racism as well. And I'll never forget sort of the circumstances where I literally talked to PSWs working in these COVID-19 outbreak long-term care homes who actually were asking me for PPE because they were not provided PPE by the management of the home, which of course was a private for-profit long-term care home. Where is the accountability and where is the justice for these health workers who put their lives on the line and actually died during the COVID-19 pandemic to protect our elders and did the best they could in these most harsh and unreasonable circumstances? So that's something we have to ask. Now, another question that's coming in. This is actually a great question, and I'm sure all of us are feeling like this at this point in time. There's, I think, a sense of frustration that's going on. How can we move these politicians who seem so unwilling to spend the money and change the system? Do we need to get profit out of elder care? Should this be a fully publicly funded system like other aspects of healthcare? What do you think, Sharleen?
Yes, yes, yes. Definitely, it has to get out of the for-profit system. I'm ashamed to even say that people make money, earn money, shareholders get their checks on the backs of workers who are delivering that care for our loved ones, but on the backs of seniors, like we've said, that have given their all to society, and these are the end of their living years, that people make profit off of that absolutely has to go. And I'm not saying, I get it. I've been criticized for saying it. Well, come on, we can't just, rip the carpet out and no. But there's contracts that are expiring and being renewed. Start to phase it out. But for the politicians to sit in their offices and say, this can't be done, I need to ask the question, who really are you caring about? Is it, like we said, the former premier that's on those boards? Is it some of those lobbyists that you want to address and make sure that their priorities are met? No. This is shameful that, especially at this point, and in the Picard comments, he talks about childcare, the same thing for the elder care. We should not be making profits out of that. It should be in the public system. It's public dollars that go into long-term care that people need to remember. It's our tax dollars that are given to those agencies to deliver care to our seniors. They skim off the top for their for-profits and shareholders, and that means that there's cuts somewhere that our seniors are not getting proper staffing, proper care, proper infrastructure, because they're skimming off the top and giving it to shareholders. So people have got to stand up, be bold, push back at these people and say, and like you mentioned earlier too, you can tell I'm so fired up about this, but you mentioned earlier about the, the baby boomers. These agencies and people working in this sector are not going to go away. There's definitely lots of work in the future. It needs to be public, and these people that are delivering the service need to be held accountable to the public for what's going on behind those closed doors. So it's politicians' responsibility. It needs to be publicly funded and delivered.
Yeah, absolutely. And I think there's many solutions that are there, but unfortunately we're seeing a lot of excuses and a lot of deflecting rather than implementing the solutions that would provide better care for our elders, provide better working conditions for these frontline health workers that our politicians don't hesitate to call heroes, but yet don't give them essential protections to live with dignity and respect, and also would have better accountability for the taxpayer. I just wanted to share with everyone that I was recently talking to a friend friend of mine who works as a health economist and a researcher, and we were speaking about how the public-private partnership that goes into private for-profit long-term care is actually one of the worst when it comes to accountability for the taxpayer. And of course, this is not just about dollars and cents, everyone. This is about people's lives and about, so many things that we've spoken about. But when we think about free market economies, I mean, private for-profit long-term care is more of a system of corporate welfare. First of all, people don't have choice. You're supposed to have choice in a free market economy between different products, but when you're waiting months or even years to get into a long-term care home, there's no sense of any choice. And then secondly, you're supposed to have competition between these different companies. That's supposed to be happening, where the product is supposed to get better and better. But here, the product is worse, where they're providing an inferior standard of care and immorally keeping these racialized women who are frontline health workers poor. So none of this makes any sense. And then on top of this, they're receiving our taxpayer dollars in the middle, even right now, of a major economic downturn, and then turning around and paying shareholders dividends. I mean, where does that money come from? You'll hear a lot of spin from these companies where they'll say, well, even when they received the emergency wage subsidy from the federal government, that they gave it all to the health workers, but they were continuing to pay their shareholders dividends and even maintain their dividends through a pandemic. And there was no different color of money. I promise all of you, there was no different color of money that was coming in or coming out. It's the same. So really, we have to kind of make those moves, hold these for-profit long-term care homes accountable for a specific standard of care, have a system that's fully transparent and accountable to the taxpayer, and especially for the people that are living and working in these homes. And of course, no new homes should be provided to private for-profit long-term care operators. They should be given to not-for-profit and municipally funded homes. So there are many solutions. It's not an overnight sort of thing, as Sharleen has mentioned, but it can happen, and it's just a matter of political will. It's just a matter of political will. Okay, so moving on, we do have some other questions. I'm just seeing here, I think we've sort of addressed this. So, here, this is a good question. So if the government were to revoke the license of a long-term care facility that is not providing acceptable levels of care, what would happen to the people who live and work there? So what do you think, Sharleen?
Well, that's been an experience that we have had over the last 16 months. There is a shortage of caregivers. So if they were to take it, move the residents out of a for-profit facility, if that was the case that you'd have to move them, the workers would go with it. The workers are not the problem. We've got a shortage of caregivers. So they would go with the work. It's got to be, providing care to the residents that are there. It would definitely be moved into the not-for-profit system. We start investing more in the infrastructure in not-for-profit, again, money going into infrastructure for the for-profits. Whether or not it's completely going there is questionable. Nobody really wants to pull out their financial books and identify what's the money given to me gone to improvements. So definitely people would be taken care of.
Yep. So, okay. I mean, I think that's a great answer. And we know that the solutions are there. I just wanted to add that during the pandemic, we've seen these hospital management orders where publicly funded hospitals actually had to make up for the mistakes and of the egregious failures of the private for-profit long-term care homes. And that really once again shows us that we need complete accountability in the system. And while we can't immediately take away all the licenses, there is a way, and it has to start with some accountability and justice, where we just cannot allow the neglect and the failures to continue. Okay, so one last question. I think we're getting to the end of our session, Sharleen. So is there a jurisdiction or country that you've seen doing long-term care well? Any best practices from other countries that Canada should adopt?
Well, I mean, recently we've all witnessed some of the positive things that have happened in Australia, for one, definitely. And then even in our own country, when you see early on how some of the other provinces, BC, reacted quickly, Quebec again did some great things. I mean, there's many countries that are an example, but you don't even have to go far away from home. Just take a look at some of the other provinces that have stepped up. BC right away ensured that workers had full-time jobs and pay during the pandemic. If you can do it in a 12-month or a temporary time when we're all in a life-threatening pandemic, you can do it full-time. And, just again, on revoking the license, I just want to say again, Dr. Arya, I mean, extended care had some real penalties in the United States imposed on them. I think it was by the Biden government, or sorry, Obama government. And they left there and came to Canada. So why wouldn't we treat them the same way? Why is Canada looked to be a dumping ground that if you're not good enough in one country, you can come here?
Yeah, some great points, Sharleen. Great points. And I'll just add on the issue of jurisdictions and countries. I mean, there's been a lot of research that's been done on long-term care internationally, and I'm not really one to speak about that. But from what I've read from many experts, I mean, a lot of people do look at Denmark, for example, as a country that we can look at. And once again, this principle of thinking of long-term care not as a place, but rather as a verb, where here in Canada, we disproportionately fund this institutionalization of our elders and people with disabilities. We spend a lot more money on that as compared to home care. And that model is flipped, where we could actually look after more people if we spent more money on home care. And this would undoubtedly fulfill the wishes of our elders. So that's something that's very important. And as we know, having a system that's publicly funded, accountable to the taxpayer, will be something that we all cherish and value as we grow older, and as our parents or grandparents undoubtedly will enter into the system if they're not already requiring services from the system. I think that COVID-19 is really, it's, peeled the Band-Aid off the open wound that really is our long-term care system. And now is the time to fix this system. And once again, all of us have to organize, rise up as a society, and hold our politicians completely accountable.
Agree. The right people, the right place, the right time. Staffing levels, the conditions of work definitely impact the conditions of care. Respect, dignity, and quality for the workers and the people that they take care of will have much better outcomes, and the last year has proven that. Dr. Arya, I want to thank you so much for our time together during this session, but also over the last year. It's been such a privilege working with you. I look forward to working with you in the future to try and improve this very critical service that we provide the loved ones, our seniors.
Yeah, I'm so grateful to be on this panel with you, Sharleen, and sharing this very important discussion. And I learned so much from your advocacy, and I'm very, very thankful for the powerful voice you bring to protect our seniors and our frontline health workers. Thank you so much.